Scientists can now identify an obsessive thought in your brain before you are even aware of it. This is not a scene from a science fiction film, but a medical reality for those living with treatment-resistant obsessive-compulsive disorder. Researchers have pinpointed a specific electrical signature, a unique neural fingerprint, that appears the moment you feel the urge to perform a ritual. So what exactly is this signal picking up? And how are researchers using it to build a pacemaker for the mind that intervenes at the moment of your greatest need? Let's start by looking at what is actually happening inside an OCD brain. Most people think of OCD as a desire for tidiness or organization, but for the 2 to 3% of the population living with the clinical disorder, the reality is a debilitating neurological loop. It begins with an obsession. This is an intrusive, unwanted thought that triggers intense distress. To quiet that anxiety, your brain demands a compulsion, a repetitive ritual you feel forced to perform. The difference between checking a door lock once and living with clinical OCD is the difference between a single notification on your phone and a system-wide alarm that never stops ringing. It consumes your hours. It disrupts your life. And for nearly 1/3 of patients with severe symptoms, traditional therapy and medication do not work. This is the part most people miss. This is no longer a question of your willpower. It is a question of your wiring. How can you stop a cycle that your brain has already decided to complete? Here is where it gets interesting. For years, neuroscientists have focused on a specific network in your brain. This circuit connects the frontal cortex, the area behind your forehead, to the basal ganglia, which are structures located deep in your brain's center. Think of this circuit as your internal error detection system. Usually, this system flags a problem, such as germs on your hands. You wash them, and the signal shuts off. But in the OCD brain, the off switch is broken. The system stays in a state of high alert, leaving you with a permanent feeling that something is deeply wrong. One critical part of this loop is the orbitofrontal cortex. It sits just behind your eyes and helps you evaluate threats and make decisions. In your brain, if you have OCD, this region is hyperactive. It exaggerates small risks until they feel like life-threatening emergencies. But here is the reality check. Knowing that a brain region is active isn't enough to help a patient in real time. To stop a compulsion, researchers needed to find a specific electrical pulse that says, the obsession is starting right now. In 2 landmark studies published in 2024 and 2026, they found that pulse. Now let's look at what this actually means for you. In a 2024 study published in the journal Neuron, researchers successfully tested a responsive deep brain stimulation system. You can think of this as an intelligent pacemaker for the brain. While traditional stimulation stays on all the time, this system is a silent observer. It listens to your brain activity and only acts when it detects trouble. Imagine a surgeon placing hair-thin electrodes into your ventral striatum. This is a deep-seated region that governs your motivation and habits. The system then watches for a specific pattern. A sudden spike in low-frequency electrical oscillations, or rhythmic waves of electricity that match your obsessive thoughts. When the system sees this pattern, it delivers a precise burst of electricity. This jams the signal, disrupting the obsession before it can take hold. In one case, a 31-year-old woman with severe OCD saw her symptoms drop by 37.5% in just 24 hours. After 1 year, her rituals dropped from 3 hours a day to just 30 minutes. She could finally live her life again. But let's go one level deeper. In 2026, the same team published further findings in the journal Cell. They identified an even more specific signal: low gamma oscillations between 30 and 55 Hz in the anteromedial orbitofrontal cortex. This specific frequency acts like a volume knob for distress. When researchers showed patients their triggers, this signal spiked immediately. But when the pacemaker delivered stimulation to the ventral striatum, the signal quieted. The distress faded. Think about the implications of that shift. We can now see a thought as a physical wave of electricity, and we can use electricity to stop that wave from crashing. So what happens to the mind when we begin to edit the brain? This discovery is a historic turning point in how we view mental health. We have moved from general theories to actionable biomarkers, precise electrical patterns that we can track and change. For those who have felt their struggle was invisible, this is biological proof that the pain is real. But here's the problem with how we currently view this technology. It still requires invasive brain surgery. It is currently reserved for only the most severe cases where nothing else has worked. However, the proof of concept is now undeniable. We can catch a neural signature and intervene at the exact moment of crisis. This raises a difficult question for the future of neuroscience. As we gain the ability to identify and silence the specific brain signals that cause suffering, where is the line between treating a disorder and altering the fundamental way you think? If this made you think and learn something new, please like and subscribe. It really helps with the channel. Thanks for watching.